What if the back pain, leaking, heaviness, or pressure you feel during or after pregnancy aren't just part of being a mom, but signs that your pelvic floor is asking for support? Today's guest is here to help you understand what's normal, what isn't, and how healing your pelvic floor can only really change your entire body. So come join us. Women's Wellness Authority is your go-to podcast for discovering the hidden gems of holistic health and well-being. In each episode, we dive deep into the many layers of wellness, from mental and physical health to spiritual growth. Through insightful interviews with experts, healers, and thought leaders, we uncover alternative approaches, healing practices, and fresh perspectives that empower you to transform your life. Whether you're seeking innovative ways to heal your body, your mind, or nourish your soul, this podcast offers practical tools and wisdom to help you thrive in all areas of your life. Let's rewrite the rules of wellness together. Step into your power, reclaim your health, and discover what it means to truly thrive from the inside out. Welcome back to Women's Wellness Authority. I'm your host, Diana Ruskowski, and today we're diving into a topic every woman deserves answers on, and that's their pelvic floor health. Whether you're pregnant, newly postpartum, or years past childbirth, but still feeling disconnect, pain, or pressure, you are not alone. And you don't have to guess your way through your healing. My guest, pelvic floor specialist Khyati Merchant, sees this every single day. Women overwhelmed by options, confused by symptoms, or brushing their own needs aside while caring for everyone else. She helps women understand their bodies, their goals, and how to rebuild strength, connection, and confidence from the inside out. In this episode, we're breaking down the basics of pelvic floor therapy, the signs to look for during pregnancy and postpartum, and the emotional side of healing, and simple steps you can take no matter where you are in your journey. So, Khyati, thank you so much for joining us today. So before we get into the science, can you share your story? What inspired you to become a pelvic floor specialist?
There were a couple of reasons for sure. I love treating my patients one-on-one. When I'm treating them one-on-one, I would love to kind of educate them, tell them which body muscles you're using, what is the priority, which I can do that when I am doing pelvic health physical therapy. That is my first thing. And the second thing was my own experience. When I was pregnant at that time, I was not at all aware about my pelvic health, and I was very conservative. So never talked about it to anyone. Long story short, after my delivery, recovery could have been very different if I knew my pelvic muscles better. And not just that, my core muscles of the abdominal area would have been better as well. So I felt a huge understanding about pelvic health after my pregnancy. I wanted to treat my patients one-on-one. And me being a learner, I decided to start with pelvic health in 2019 and never looked back. I enjoy treating my patients one-on-one, educate them about all the wonderful things that our body has to offer. Our body's so very well connected that I realized after this course, and it gave me kind of an eye-opener in terms of connecting the past. When we think about past as like old is gold, the reason I feel like is kind of applied to this was because I learned about yoga in 2007 with the teacher's training course, some of the breathing exercises they would offer, and how it implemented so well in the pelvic health world. And kind of with our connections of different parts of the body, it just kind of gave me goosebumps when I think about it, how it is so interconnected, related.
Yeah,
And
and
all of
that's a
that.
sign that it was like meant to be, right? That you're going to help other
Yes.
women with this. I think it's so common that women don't talk about this and suffer in silence, like with pain specifically within your pelvic floor region. Because I felt very much the same. And I also remember after giving birth the first time, why didn't anybody tell me what was going to be going on? And also, like, I kind of was just told by my doctors, you had a baby. So, yeah, these symptoms that you're having and the pain that you're having and these things you're experiencing are just like a result of all of that instead of really fully understanding it. I never got pelvic floor therapy. I actually ended up seeing somebody once, but never went repeatedly. To your point, how different my recovery could have been had I felt like safe enough to share those things. But why do you think that is? Why do you think women don't talk about that?
You're so right, Anna, on that, because our emotions are very connected, right? And when we think about our pelvic health or pelvic area itself, a lot of our thoughts comes from the past. We don't talk about our body very easily with everybody. And as the pelvic area is very much connected to our intimacy, that also plays a major role. We kind of body shame a lot. Before my pregnancy, I always used to think like my pelvic area is mine. And during the delivery, I realized it is absolutely not mine. Absolutely no. That is the main reason when I was open to learn about pelvic health. When we have to undergo the training for this particular courses, we have to be model ourselves. And I was not ready to be a model for my own learning. I'm like, nope, I'm not ready for that. And I given up the opportunity to learn and do things in one of the university in Texas where I was before, Texas Women's University, and I did not go for that. And just after 5 years after my delivery and when I was ready to, give so much time for it, the same university I went again for the entire 1 year certification.
Oh, how
That
funny.
Yes. So I think first of all, the experience matters. Along with that, we didn't have the wide social media at that time. That is another area that is kind of limited. The third thing I do think is that a lot of people try to be in their own bubble. Long back, when women were not working, they would have their own group, they would talk amongst each other, and they would laugh. And that was common, which has changed a lot in the recent years with women doing working, managing house, kids and everything. They put themselves in the back burner, absolutely. And that plays a major role as well in our thought process. And as you mentioned, that nobody told you to be at, go to a PT at that time. Truly speaking, Diana, I had gone to a PT, but it's very under-researched area. And because of that, the things which were 5-10 years ago evaluated, looked up, is changing a lot at this time. The wellness is coming more into the picture rather than just looking the pelvic health in relation to any kind of disease or any issue. As we will talk, there will be a lot of reasons that you will understand that our pelvic muscles, pelvic area does not tell you immediately that, oh, I'm not well. It's something like if you are tight in your cervical area, upper traps, or if your calf muscles are tight, you're going to feel those when you're walking, when you are moving your neck or shoulder, and respectively. Our pelvic muscles, if they are off, they don't tell us that, oh, I am not well, unless we start having the symptoms for that. So the communication with our body is a little bit different in that area. And that also pushes our treatment, our need for pelvic health on the back burner.
Yeah. You were saying it's so common, right, for women to, and it makes sense. You're taking care of maybe a new baby, you have multiple children.
Yes.
Then they get a little bit older and you're like, you don't maybe even have a sense of the pain that you're experiencing and that it's related to that, and you don't have time now because all the other activities. And so you definitely take a back seat to that. Can we take a step back and just define what pelvic floor therapy is? So just start real simple. Yeah.
Yeah. So pelvic floor physical therapy, or I would say pelvic health physical therapy. And the reason I would like to kind of include pelvic health and not just pelvic floor is because pelvic health is more of a therapy, physical therapy itself, focusing on the pelvic area. Along with that, its connection with the different body parts that we have. So our lower back, our hip, feet, TMJ joint, neck area, they are all interconnected. And when we think about pelvic floor muscles, the pelvic floor muscles are the muscles. If you're sitting right now, the muscles of the pelvic area is going to go from the sides of our two sit bones that we are sitting on the sides, and on the front part from our pubic area back towards your rectal area. So I have my model with me to show you. This is the pelvis that we are talking about. And if you think about this is the coccyx area, the back side. So it goes from here to here, and it goes from the sides, the two sit bones that we sit on. So if you look at from the top down, see how open it is. And if you look at the model with all the organs being taken out, like bladder, uterus in female, prostate in male with rectum, then we end up seeing something like this. So this is our bottom part. This is our bottom part. And if you look at it from the top down, this is what we see. And as you can see, it is the pink are all the muscles.
Oh, wow.
So these are the areas that we kind of
That's a lot of area, by the way.
And you feel
to
like
ignore,
it is a lot
especially to ignore if there's problem.
And think about it, like I'm going to put all the organs in and imagine how nicely they are situated. So this is that uterus with the vaginal area. This is your bladder that goes in the front. And on the back, we have the rectum. So this is all that is situated in this area. This is how our body pelvis is. And when we take that out, the floor part, that is what it remains. Now, they are so, if you have seen this, the muscles are going all over from your coccyx to ischial tuberosity, to your pubic area, and to the sides. Not just that, these are the parts where the hip muscles are coming. And when the hip muscles are coming from the spine on the top, attaching into the front, into the back, they are talking to each other so much. So the pelvic floor PT is physical therapy related to pelvic floor, connecting your lower back, your hip, your neck, your TMJ, feet, all of that, addressing your musculoskeletal issues. So when we are thinking about any dysfunctions of those muscles related to bowel, bladder issues, or our intimacy, that is what we work on.
And I mean, a silly question, but what is it if I came into you? Am I doing exercises with you? I mean, obviously you examine the women and try to identify, but is it like when I think of like physical therapy, I'm thinking of when I've injured myself, I'm doing small bits of exercise, but are you doing those things, but for all of the muscles you just showed us?
When a patient is coming, first of all, we do detailed assessment, right? So we try to go to your past as much as you can think of, to the point where when you started with your periods, detailed about your bladder, your bowels, if you were having any constipation, when you were in the childhood era, or when you are right now, how is your digestion? How much is your water intake? So all the details that can go with your bowels and bladder, your period routine, your hormone levels, that is what we kind of look into. Major part of our initial assessment goes into knowing about your reasons and the history. So sign and symptoms of the current issues and the past history. Our pelvic floor assessment comes maybe about 10 minutes for during the assessment. But before that, we look, how is your posture? How do you hold yourself? What is your muscle tone in your abdominal area, hip area? How is your neck that you're holding? How is your spine? What is your muscle strength in them? That is what we look for. And following that, we do our pelvic floor assessment where the patient is completely covered nicely with one glove lubricated finger that we use to assess tone of the muscles, strength of the muscles. We look for if the muscles are kind of functioning the way they are supposed to be when we are putting the demands on them. So that is what we do. And once that is done, we connect dots. We make sure that we have taken into the consideration all the other pieces, and we try to give our assessment to the patient at that time, that this is what is going on, this is how we can work, and the treatment plan is curated absolutely for each individual according to their, presentation. It may not be possible to come up with reasons on the first session itself, because as you can understand, it is a lot to kind of consider. And the priority, I definitely go as a priority depending upon your signs and symptoms. So if the issue needs, I feel like, okay, the pelvic needs to be addressed first, that is what I go for immediately. But, that shift happens
Yeah, it's going to
accordingly.
depend. It's going to depend on the
Yes.
assessment. Now, something that I find really interesting, and one of my best friends I grew up with has the very same theory as you do, and I think it makes total sense, is the emotional connection, especially in this area, and the nervous system connection. So emotions and nervous system is fully connected with how those muscles act as well, right? So can you talk about that connection a little bit and why it's so important? It's not just the physical symptoms, but also potentially the emotions behind that is manifesting itself in those symptoms.
So, as I said earlier, it is not just merely an absence of disease that when we are thinking about the pelvic health, it is about how coordinately it is working physically. It is very much attached mentally and emotionally. And the reason is that our nerves in the pelvic area is quite a bit, exponentially much more. The second thing is that our pelvic muscles does go very much hand in hand with our intimacy. And when we are talking about that, it is very much related to emotions. So that area do have connection with our emotions. The third thing is that when we are talking about core muscles, the pelvic muscles are part of the core. In fact, it is right now primary muscles for our body. We always talked about core as an abdominal muscles, but in our body, the pelvic muscles are first muscles to support you, even when you are thinking about lifting your arm up. That lifting your arm up, just simply, if you do that, you will notice that there is some muscle activation around your lower back area. Now, if I'm doing right side, do that right side, and you will feel some movements on the left side
Yeah.
of your lower back.
Yeah.
Now, think about it if you are trying to lift a 5-pound weight, or if
Yeah,
you
you're
are.
right. You do feel it.
Yes.
Yes. Okay.
Right.
Okay.
So even a momentary microsecond previous of your movement, you need that stability. And that stability is given to you on the floor. If nothing is around here, everything is muscles and ligaments. Think about it. They need to work first in order for you to be
To
able to
create
be
that
supported
stability.
for
Yeah.
all the
Okay.
organs. Bringing it back, they are the primary muscles for our support. And if we are in fight, flight mode, or if we are very relaxed, it is going to give you some kind of effect through our body. Our body keeps the score in terms of some part of the, how we have trained it, how our brain has made connections. So it goes into certain area, that stress or the thought or emotion. And that is the reason that it has made such a great connection unknowingly that we don't even realize it on a day-to-day life.
So
And
interesting. Yeah.
yes, it is working constantly for us. Sitting, standing, moving, it is working for us.
You know what? I never thought about it like that. I mean, I am a very visual person, so that the diagram of the spine that you showed and the muscles and then holding everything in, visually that just turns a light bulb on for me, right? Because it's the whole muscle is the floor of your pelvic region. And if all of those organs are in there, yeah, that needs. And if it's not, if it's weak, then yeah, obviously things are going to be off kilter, and then add emotions on top of that. I know there's a ton of emotional things that can happen, be trapped within your body, and trauma or mini traumas or like anything, birth is a trauma, even though it's a
Birth itself,
beautiful
yes.
blessing, because it is an experience, and every experience, no matter how many children you have, is different.
Yes. And when we are talking about like pregnancy and postpartum, we cannot forget about puberty. That itself is like a change for a girl. And during that change, a lot of emotions are going on for that particular individual. And depending upon how that individual is holding that emotion, that stress, we have a lot of other things going on during that time. The schools and friends, and obviously the demands are endless. So even puberty itself is a huge stage of difference. And truly, I mean, I won't say I don't like too much to talk about trauma because that word can be taken in a very different perspective. But I would say that our emotions and thoughts during that time does affect our pelvic health and how we are thinking about it, how we are accepting, appreciating the other's perception to ourselves.
So interesting. I want to specifically focus in on signs and symptoms when you're pregnant and then also when you're postpartum. So, what are early signs that someone should see a pelvic floor specialist during pregnancy? I would think I should just see it afterwards when everything's happening. But I know actually, when I was pregnant with one of my daughters, I had constant, I used to call it a pain in my ass. But now I'm like, because it was like just a nerve from where the baby was hitting. And I just assumed like you
That
just
is
have,
what it is.
yeah, you just have to kind of deal with it until they're out. But I probably should have seen somebody.
Yes. How old is your daughter?
Pain that I experienced, she's 7 now.
Okay. So definitely there was awareness and kind of more options for sure for you, but the time has passed.
Yes.
Um,
So what are some signs that like that was a sign, but yeah, I think it would be helpful.
so I would say that considering our pelvic health, as we don't have a lot of research so far in that area, it is always good idea to have a little baseline. And when we are talking about the baseline, that is what I was talking about in terms of wellness point of, and having a baseline gives you an understanding where and how your pelvic floor is working
Okay.
for you. That gives us a little bit of, because everybody is different. And when we think about our pelvic floor muscles are not just like our biceps or our quads. They are a little different. They are kind of working as a kind of a trampoline where the net of that trampoline kind of goes down all the way and then comes up. So that being said, the contraction of that particular muscles are more efficient when they are stretched out beyond their normal state. When I'm saying beyond the normal state is like, okay, this is my hand, and if I'm moving it down, this is like a shortened position. This is opening. I don't need to go this way in order for my hand to go out. Even if I'm here, I can go. I don't have to do this to do that. Something that is different.
That can happen during pregnancy, maybe just because of the movement of the baby and the muscles. Also, I was told, specifically in that reason, tend to, is it relax because of hormones that your body is sort of signaling to your body for your hips to relax so that they can open up
Yes.
to allow for the growth of the baby. Is that
Yes,
yeah.
absolutely, it is true. However, we do need to have a normal tone for the delivery. If you're completely stretched out, the baby's head kind of positions itself against those muscle tone and kind of goes into the proper position before the delivery. If you don't have a normal tone of those muscles, that also interferes with the baby's position and the delivery can be affected. The normal tone of the muscle is important. But when we do the assessment beforehand, it gives us a baseline. And following that, if you are pregnant, you understand what is your capacity, how the muscles needs to work, how much your body is kind of, what is your range. When we are talking about the range, the normal range for your body could be a little different than what other person's normal range is. It's not going to be a huge difference, but there will be a difference. We look for the muscle tone in the pelvic area. But when we are talking about the sign and symptoms during the pregnancy that we want to see, anything related with incontinence issues with the bowel and bladder, that is obviously that goes without that. But the pressure in the pelvic area, pubic symphysis, like a pain in the front of the bone when we are pregnant, that is very common. Many women are not able to take step or walk properly or do go up and down the stairs. So that is when we see pelvic floor issues very significantly. Lower back pain or SI joint pain that can be addressed. And what happens is when we are seeing those patients during the pregnancy, the pelvic muscles have better tone, better strength, and better control for better delivery. And that improves a lot during that time.
I wish I had you. I went to a chiropractor and it like relieved, but
Yeah,
The
so
delivery
absolutely.
was not, it
Was
was,
not
yeah.
during the pregnancy. If you're seeing the client, these are the issues that we work on. Recently, I had a patient just wanted to make sure that everything is okay. And when I was
Kudos to
assessed,
her.
kudos to her.
Yeah.
Absolutely. She
Yeah.
was very much pro health. And when I was assessing her, as I was telling you before, there are no sign and symptoms necessary for you to appear because they don't talk the way our other muscles talk. I strongly recommended her PT because of the dysfunction that she was having following that. So that can help her with proper positioning, which position can be better for her during the delivery, while during the delivery phase, pushing phase, is she creating efficient effort or not? Whether her efforts are kind of equipped with the proper breathing. I always tell my patient, oh, please, please, please listen to your provider. At that time, you have to listen to them. But at the same time, if you can avoid true Valsalva and like grunting and all the way down, yes, you want to avoid that. You want to create that pushing effort efficiently so that you are targeting just particular part of the pelvic area without creating the entire body to push down.
Well, and it's also you knowing your body more intimately because you're working with someone who's like teaching you the right muscles to use versus because there is totally a difference. And I've heard about ineffective pushing. I would say the first time around I was ineffective and the second time around was better because I feel like I was a little bit more educated on that. What about postpartum? So say I didn't get that initial baseline, but I'm having certain symptoms. What are the most common symptoms you see in postpartum women that we should consider to not be normal, right? It might be normalized, maybe like my
Absolutely.
situation, but it's not.
Absolutely. I would say postpartum, give yourself about 4 to 6 weeks. Do not think about strengthening your pelvic floor immediately because there are a lot of women who ask me, can I start with the Kegels the following day? And I am going to say no. Okay. So that is why I'm telling this. Like, give
I would
yourself.
have never thought of that post day 2.
I want to go pee and poop properly.
Yeah, like I just want to actually be able to sit up.
It doesn't matter if you have undergone C-section or vaginal delivery. Give yourself a good time for 4 to 6 weeks for sure. Unless you're in pain, definitely pelvic floor PT can help. If you're a pro-health person, there are a lot of other things that the pelvic floor PT can do, but definitely not Kegel. No, Kegel can be started in just about 3 or 4 days when you feel like less soreness, ease. Start with 5 repetitions and understand what is Kegel.
Yeah,
That is
what is
important.
Kegel? What is Kegel? No, really, what is it?
It is not surprising me, but you're right. And the Kegel is like simple activation of the pelvic muscles, the muscles which are on the floor part of the pelvic
Okay.
area that we are talking about. And when we are these these muscles,
Okay.
what we are talking about, the activation of that is Kegel. That activation is Kegel, but start with breathing. Postpartum, my first advice to each and every woman, they can start from the day one, is breathing. The sign and symptoms of incontinence issues, severe constipation, not able to poop properly, or if you go for a bowel movement and you feel like, okay, I haven't completed it, lower back or hip pain that kind of constantly lingers. Many a times women have anterior hip pain that they have difficulty taking a step. So that is one area. Or lower abdominal, especially with the scars, the C-section scars, those are the areas that you want to see pelvic floor PT for sure. If you are having dryness, definitely estrogen and progesterone during that time. If you're breastfeeding, that matters as well. But that creates an impact on the vaginal health at that time. But what happens is that because of the irritation and pain and dryness, that creates a dysfunction in your muscles around the pelvic area. You want to make sure that that is kind of going appropriately at that time. If you're feeling weak, if you're feeling disconnected with your pelvic area, like you feel like, okay, you want to activate, but it's not happening, that is the time that you want to kind of diastasis recti is another one, heaviness, vaginal heaviness, or you're doing some kind of simple activity, at the end of the day you feel heavy or you feel prolapse issues.
What about, I feel like a common symptom I hear about is once I've had kids, I can't jump on a trampoline. That's a sign of a weak pelvic floor, no?
That is definitely a sign of weak pelvic floor. And I feel like that is kind of comes maybe a little bit later, when you are 2 months, 3 months down the road, when you feel like, okay, you feeling much better. And that is when you start having it. When you are doing your daily routine activity, jumping or running or any simple lifting activities, and if that is creating leakage, even if it's a small amount, you definitely want to kind of see what is the connection. And pelvic floor PT helps with making those connections. It will be their job. It is our job to know whether your hips are weak, whether it is coming from the core abdominal muscles, whether it is coming from the pelvic muscles. Those dots are connected by the pelvic floor PT and kind of guide you in the right direction so that the leakage does not happen. Because when we are talking about the leakage, it is the entire pressure system is assessed by the pelvic floor PT. And that kind of gives you a better understanding of how to improve that. If one is doing some kind of HIIT training, or if they are doing strenuous weight exercises, and if they are leaking. So the individual who are lifting heavy weights or those who are runners, they tend to face these kind of issues. And we are really looking for a great, like excellent strength and endurance with your ability of managing the pressure at that time.
We talked about the, nervous system connection with the pelvic floor area. Say I'm like 7, 8 months pregnant. I know breathing work can sometimes help with that connection. Are there things that a woman could do at home that might help her sort of get in the right mindset and help foster that connection if they're not feeling the symptoms? This is during pregnancy that you mentioned.
If during the pregnancy, if they are not feeling any symptoms or anything, or postpartum done, I would 100% say breathing is a great resource. Breathing helps any individual to connect with their body. And when we are talking about the pelvic muscles, that is where our target should be at that time. When we are doing those breathing, our system, our body is so amazing that it has its own management of the pressure.
Okay.
And our pelvic muscles are very well connected to the diaphragm. And as we are breathing each and every time, the diaphragm going up and down kind of creates the same impact to our pelvic floor muscles for our body to manage it. So when we do efficient breathing, it creates good controlled movement for our pelvic muscles as well. And as you can think about, like our vagus nerve, if you know, vagus nerve is a parasympathetic nerve. That being said, it helps with our relaxation. It helps our digestion. It keeps our heart, like all the basic system of our body, systemic system in our body, kind of in check and kind of stays away from our fight reactions. So when we are doing this breathing exercise, that vagus nerve passes through the diaphragm all the way down into the digestive tract, and that gets stimulated. So that creates us a little bit of a relaxation feeling. As we talked about, our muscles of the pelvic area are very well connected to our emotions. The connection of our mind, stress, or calmness gets immediate impact on our pelvic muscles as well. So breathing is one thing that I would recommend to each and every one postpartum to do that for sure.
I mean, really, for everybody, anytime, all the time. I mean, I didn't even think about the benefits of breathing when you described the interaction with the diaphragm and how that then also pulls in the pelvic muscles as well. Like, as always, like everything is so interrelated, right? It's not just your pelvic area and any issues there are just there. Like,
no.
I could breathe and actually be focused, and it changes so many things.
And that is one of the things that we do to manage the pressure. Another thing that postpartum individual can do is create exhaling efforts. So especially women who has to lift car seats, carry their baby, or the elder one and then the younger one. So that is like a strong changes that is kind of demanded on the body immediately after the delivery. Creating exhalation during your strenuous part of the movement will help you activate your muscles of the pelvic area better. So if you're simply lifting a car seat from the floor, you just want to go ahead and breathe out through your mouth while you're lifting that car seat. That will help the muscles of the pelvic area to work more efficiently. That also helps our lower abdominal muscles, the core muscles, abdominal core muscles to get activated. And definitely listen to your body. Your body tells you much more than what it can do. So breathing, exerting with breathing out, a lot of relaxation in the beginning, early time. That is one thing. That is another thing that they can do. And be kind to yourself.
Yeah,
100%.
that's always so important. I have a question. So what if you don't address these issues? Can that have repercussions? I mean, in another episode, we're going to talk about perimenopause and menopause and pelvic floor health. But if unresolved, some of these things, so say I never actually fixed the fact that I pee my pants every time I jump or run or on a trampoline. I know that's a very specific example, but what kind of things can that manifest into other issues down the line if I'm not addressing?
Think about it as our pelvic muscles are the core muscles. And if the core muscles are not functioning efficiently, our body is going to compensate and it is going to continue to do work that what you are putting a demand on it. So if you want to run 10 miles and if you have made up your mind, your body is going to run 10 miles, even if you don't have any muscle strength in the pelvic area. It is going to rely on your lower back and the abdominal core muscles and the hip muscles. And the next turn comes for the other area to compensate is that the one that is kind of straining and supporting the most, because those muscles are going to get tired very easily. It can be simply your feet. If you have a flat foot, it is going to kind of give you a pretty good answer like, okay, I'm not happy. It can be in relation to end up with constipation issue because you are not able to relax those muscles. They are weak, they are tight, and you are not able to poop properly. Or you may be able to go to the bathroom and you're like, okay, I'm not done yet with the bathroom. Or you start with incontinence, because when we are talking about leakage, we are forgetting that we also want to empty our bladder when we want to and how much we want to. That is a control that has been done by our muscles in that area. And that is going to be lost. So it can manifestate in many different ways.
Yeah.
Many different ways. Simple abdominal pain. You may end up having hysterectomy. You go and do the hysterectomy and I have seen so many cases where they continue to have pelvic pain because the area is so much jacked up that the muscles in those areas are now constantly being on fire. The nerves are so irritated that they are not able to differentiate between the right symptom and right response to it. And it just kind of creates like, okay, I'm not happy.
Yeah. And you and I spoke when we were preparing for this call that pelvic floor health should be just like we go to a gynecologist, a pelvic floor health specialist should be part of our healthcare. It shouldn't just be, I'm going to go see a specialist because I have these issues. It should be something that every woman is doing to evaluate their state, because then longer term, right, you might be able to avoid some of these issues. So this is like a PSA. If you've never seen a pelvic floor specialist, especially for new mamas and postpartum mamas, go and see someone, because the worst case scenario, or I should say the best case scenario, is that they say your pelvic floor is the strongest I've ever seen. Thank you so much for coming in. You don't need to see us anymore, right? I think that's probably never the case, but yeah, we just talked about it should be more integrated, right? In everyday health.
Absolutely, 100%. I don't want to divert from that point, but yes, you're right. And it should be part of your routine. As many a times, I really think, like, I'm not going to say that every woman should see pelvic floor physical therapist again and again, but on a regular interval, as we think about, like, we do go for our mammogram, we do our blood assessment on an annual basis. The reason for assessing your pelvic health on a regular basis, that being said, maybe during the puberty, we generally don't do internal because that's a too early stage. But during pregnancy, postpartum, perimenopause and menopause. Those are the time frames.
Those are the big events. Yeah.
Big events for the women, and it goes through a lot of changes. And in order for us to prevent those extremes, those are the times, if you're considering, those are the times.
I was going to ask you, like, what are maybe last parting words or advice that you would have for someone who is pregnant or postpartum, but maybe that's it. But I will pause. Maybe you do have additional things to share, because I think that sort of almost answers my question, but there's always more.
There is a lot more, but yes, I would say your symptoms don't define you. Your timeline is unique. Each individual recovers differently. Each mom, you are doing amazing. You guys are strong. Your body deserves answers and care without any judgment. So just go for it.
That's beautiful. That without any judgment too, I think is so important, especially with social media, where you see pictures of new moms or you're past the 1 year mark, the 2 year mark, and all these women look so put together, but what looks picture perfect, most of the time is not. And they could be experiencing pain and all of these things that you're experiencing. You just, you don't have a conversation about it, like we talked about earlier.
Yes.
So, and if anyone is interested in working with you or speaking with you, what's the best way that they can find you?
I have my clinic in Fort Mill, South Carolina, which is very close to 77 Highway.
Okay.
It is Lotus Physical Therapy and Pelvic Health. I do provide travel, like in-house service as well, to those individuals, especially who are looking for postpartum time frame when things are crazy enough. I do provide that. So kind of giving that as a service for supporting those women. My website is www.lotusptph.com. I do show myself. I'm alive on Instagram, not very active, but I am alive, which is on Lotus PTPH as well.
Perfect. And I'll put all that contact information in my resources for anyone that wants to reach out to this. This way, if you're jotting it down, you can pause and just jump into resources in the episode description. But Khyati, thank you so much for breaking this down with such compassion and clarity. I love how you remind women that healing just isn't physical. It's emotional, energetic, and it's deeply empowering. To everyone listening, you deserve to feel strong, supported, and connected in your body. Don't ignore the symptoms your pelvic floor is trying to whisper. And listeners, thank you for joining me on Women's Wellness Authority. If this conversation spoke to you, share it with a friend who most definitely needs this encouragement. And don't forget to subscribe on your favorite podcast platform or on YouTube so you never miss an episode. And if you're enjoying the show, a 5-star review means the world to me and helps more women find us. So until next time, stay curious, stay empowered, and most of all, stay well. Thank you for tuning in to this episode of Women's Wellness Authority. If today's conversation inspired you, shifted your perspective, or sparked something within you, I'd be so grateful if you'd subscribe, leave a review, or share this episode with someone who might need it the most. Have a story of your own or something you'd like to share? I'd love to hear from you. You can connect with me on YouTube, Instagram, and Facebook at Women's Wellness Authority. Please note the content shared on this podcast is for informational purposes only and is not a substitute for medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider regarding your health and wellness decisions. Until next time, stay curious, stay empowered, and most of all, stay well. Thanks, everyone.